The search for the cause of the mystery disease AIDS is being stepped up in Australia. This week, the National Health and Medical Research Council announced that it would set up a working party to monitor the disease, which has killed not only gays in the United States, but also Hispanics, people with blood disorders, and users of the intravenous needle. Recent research in the US suggests a human leukemia virus might be one agent causing AIDS. But a Sydney biological scientist says that while science is having problems in coming up with a solution, the answer might be with social reform. Dr Atuhiro Sibatani is talking to Cheryl Taylor.
Self is uncurable at the moment, but they are at least developing the quick detection method. Only thing we can do at the moment is the social prevention.
How would you describe social prevention?
One thing they are saying is that the blood transfusion to be restricted to only the healthy people, and by appropriate antigen test we can discriminate, I hope.
Are you suggesting any other form of social prevention?
Yes, and I also suggested very radically that if the homosexuals can contain their alleged promiscuity, that will just reduce the chance of spread.
How are you going to get homosexuals to not be promiscuous?
If the society gives all the blessing to the homosexual status in the society without any suppression, they will be less frustrated and seek for more chance of monogamy instead of this promiscuity, which must certainly be degrading to most of them, if not all.
So are you suggesting that if they were less promiscuous, there would be less risk of AIDS being spread around?
That is, yes. So if this promiscuity is due to the suppression by the society, then the society as a whole is, responsible in a way to the spread of AIDS, and not to God the revenge to them alone. The revenge to us all. That is my philosophy.
Why do you suggest that promiscuity is caused by society's oppression of homosexuals?
Because if the one homosexual person, a male I mean, loves another male and cannot declare his love, or even after declaration, if it's, just not only flatly denied, but also persecuted for that reason, then that person will certainly not go ahead. But instead he will get some sexual compensation by the arbitrarily chosen subject, which may not be as satisfactory, so they only give the momentary satisfaction. But he has to go ahead again without having any mental sublimation in this kind of thing. And the love affair is not simply the matter of sexual conduct, but it should entail much, much higher, a dynamic person-to-person contact. So what I want to know is whether the homosexuals can sort themselves out if the suppression is not as strong as this.
So would you like to see the laws on homosexuality reviewed then?
Yeah.
What will happen, though, if the homosexual people do continue to be promiscuous? Is there any other way that AIDS could be contained?
If the homosexual people do not have the bisexual conduct. And that is also related to the way the society lives at the moment.
You mean, in other words, keep it within their own society?
Yes. Point is that whether they want to be contained that way, if, completely honored, you see, not suppressed, or do they still freely mix everything? This is their own soul searching.
Is it a moral question for the homosexual community, or is it a moral question for society?
To both, I think.
And where does the scientific answer come in?
This you can't answer scientifically. So the only intimate contact, seems to be the cause.
Dr Sibatani adding the philosophy of honour and social reform to the AIDS debate.